greetings. My name is Noah Litherland, here with Vita Dairy Youngstock Technical Specialist. Pleasure to get a chance to visit with you today about air quality and its impact on calf respiratory health. Significant challenge with this wet, damp, late fall and early start to the winter here as we look at conditions that are warmer and wetter throughout the upper Midwest, and some significant challenges in calf barns and calf hutches throughout the area. When we look at farms and try to understand what's going on, we're often posed the question why are my calves experiencing greater amounts of respiratory challenges? And we can think about that in a couple of different ways. The first thing is with wetter conditions, with warmer weather, we tend to see greater bacterial growth and bedding. That bacterial growth is associated with greater methane production and other gases that are somewhat harmful to the lung tissue. The higher level of bacterial load certainly also challenges the calves from a health standpoint and can really reduce performance. When we're looking for respiratory disease, we can look at a single calf and really learn a lot. We can look at the head specifically. Let's look at the ears. We're looking for nice, erect, even ears. Look at the eye discharge. Any calf that even has weepy eyes or a noticeable discharge is probably a good candidate for evaluation and potentially treatment. Respiratory disease is often associated with runny noses, lower or slower intakes, or calves that are just not quite as aggressive. The normal coughing, if you just take some extra time when you're doing your chores, kind of listen for any kind of telltale coughing that might be occurring, kind of find those calves and see what we can do. Evaluate their breathing as well. Rapid, shallow breathing is pretty indicative of calves that are kind of struggling from a respiratory disease. Well, what are we going to do about respiratory disease once we know that we're certainly challenged with it? As always, starting with the babies, it's important to really provide the adequate amounts of colostrum. The colostrum is going to contain antibodies to some of the viral respiratory diseases like IBR, BVD, and PI3 that the calf would potentially get. So high quality colostrum from cows that have been vaccinated with those, for example, with Bovigio Gold, they're going to have immunity kind of already built in and try to deal with some of those challenges. Vaccinations for the intranasal for the calf, such as Enforce 3, can also certainly booster some of those vaccines and make sure calves are not really challenged as much by some of those pathogens. Oftentimes we see overstocking being at a cause for some of these respiratory diseases. Typically we like to see baby calves have at least 35 square feet of surface area in order to be able to lie on. One thing we often don't talk about is the actual volume of air required by the calf in the barn. The University of Wisconsin College of Veterinary Medicine recommends about 600 cubic feet of airspace per calf in order to provide adequate volume of good quality air for that calf. So if I take, for example, a barn that's 60 by 30, so 60 foot long, 30 foot wide, and 9 feet high, that barn can hold about 30 head of calves in order to provide a little over 600 cubic feet per calf. If I increase that stocking density up to 40 calves, then we all of a sudden have only 460 cubic feet of volume of airspace for that calf, and therefore we get certainly lower quality air, greater incidence of respiratory disease. We talk about a minimum of 4 air exchanges per hour, and typically the way we measure that is we'll go to a barn and fill the barn with smoke. We then start our timer, turn on our ventilation system, and that smoke should clear out in 15 minutes completely if we're truly achieving our 4 air exchanges per hour. That number is probably closer to 20 air exchanges per hour in the summertime, but if we got our curtains closed up, we've got our positive pressure tubes on, we're looking at about 4 air exchanges per hour. Curtain management is huge. On days like today, when it's modestly warm out, we want to open those curtains a little bit and let some fresh air in. One thing we do have to know is that cold air falls and warm air rises. So if our curtains are down a little bit, the cold air can come into the barn, it's going to fall down to the floor level, and that's where it's really important to make sure that those calves are away from the outside walls, especially newborns. They've got calf jackets on, even though it's still modestly warm out at around 40, and we definitely need to make sure that those calves have adequate amounts of bedding in order to be able to nest down into them. So we think about some of the common mistakes that we do see on farm is typically too many stressors at one time. Multiple stressors such as dehorning, vaccinating, moving. Adding those all up can be a little overwhelming to the calf at times and decrease immune function and get more stressed calves with greater respiratory infections. Not having enough adequate bedding. Straw bedding is still our #1 favorite in terms of quality of bedding to absorb moisture and provide insulation to the calf. So providing plenty of bedding where maybe in the normal time we can bed twice a week. When it's damp like this, we need to bed 3 times a week and sometimes 4 times a week, depending on our situation. Making sure the ventilation is proper. Talk to your veterinarian or your nutritionist or your support staff in order to kind of evaluate the ventilation system. I think oftentimes we feel like we make some assumptions that we have adequate ventilation, whereas things like smoking the barn, using a highly accurate anemometer, and evaluating the total amount of air exchanges in the barn can really help understand why calves are struggling. Finally, we talked about some of those symptoms, the eyes, the ears, the nose, the respiratory rate. We need to really recognize those symptoms very quickly. If we can work with our veterinarians and develop a treatment protocol, identify those calves very early, treat them adequately and accurately, then a lot of our respiratory problems can be less severe and for a shorter duration if we can identify those calves early enough. With that, hope your calves are doing well, and if not, let us know. We'd love to help. My name is Noah Litherland, and thank you so much for your time.